Hi everyone, this is Akash Mangukiya and welcome to my channel. In this video, we are going to talk about USMLE and PLAB. I know this is really common topic, but we have to talk about it because right now so many people are confused whether they should take USMLE or whether they should take PLAB exam. So we are going to break up USMLE pathway and the PLAB pathway in this video according to these topics. So we are going to first talk about the steps of USMLE and PLAB. Second is English test requirement. Third is internship requirement. Four is electives. Fifth is residency. Sixth is cost, and at last we are gonna talk about salary. So in first step we are gonna see the steps of USMLE and steps of PLAB. So in USMLE there are three steps. First step is right now pass and fail. You will not get the score, you just will get pass or fail. Second step, there used to be two part of step 2, which was clinical knowledge and clinical skill. Right now it is only one part, this is clinical knowledge. You have to give only clinical knowledge, okay? And then there is step 3, and that you have to give in US obviously. So there was USMLE steps. So PLAB, I'm just gonna go through these steps very briefly, so I will not waste your time. So in PLAB, we will have PLAB 1 and PLAB 2. Then we have to do kind of FY1 and FY2 in UK. But if you have done your internship in India, you don't have to do FY1 in UK. You just have to do FY2 in UK if you have done with the internship in India. So next we are going to talk about is English test requirement. In USMLE there is no English test requirement. So if you want to give USMLE step 1 or step 2, you don't have to give English test to do that. But there is OET requirement after step 2 if you want to do certification in ECFMG. So there is OET requirement after you do step 1 and step 2 for certification only. There is no requirement for exam. But in PLAB, you need to give IELTS or OET before you give PLAB 1 exam. So that's a kind of plus point for USMLE, that you don't have to give English test in order to give the exams. So in PLAB, you have to give IELTS or OET in order to give the exam. Next we are going to talk about is requirement of internship. In USMLE there is no requirement of internship. If you want to get residency, there is no requirement of internship. But in PLAB, there will be requirement of internship. Like if you have done your internship in India, you don't have to do FY 1 year in UK, that I have told you already. So if you haven't done your internship in India, you have to do FY1 and FY2, and only after that you can apply for residency. And that is also kind of plus point for USMLE, that you don't need internship in order to match or in order to get residency in US. Further we talk about the electives. So in USMLE, you have to do clerkship or observership at least for 3 months in order to build your CV. And in PLAB, it is called clinical attachments. You have to do clinical attachments with physicians or consultant doctors. So you can attach with them and go in the rounds and learn about the UK healthcare system. Likewise, in USMLE, you have to learn about US health system by doing the clerkship or observership, whether it can be hands-on or hands-off. You have to learn healthcare system wherever you go outside of our country. In this, both have same points. USMLE and PLAB both have to do kind of clerkship or observership or shadowing. You can also call shadowing. So you will need to do shadowing in order to build your CV good. Further we are going to talk about is residency. So in USMLE, process is kind of complex. So if you want to understand matching process, you need to see lots of video on YouTube, and you need to hear about and you need to learn from seniors that how this matching process works. It is really complex, and if you want to learn it, I can make separate video about this. So in US, matching process is so much complex, and in residency, surgical specialty is kind of hard to get because your CV needs to be so much strong in order to get surgical field in the US. I'm not saying that no one gets it. So many people have gotten the residency in the surgical field. If your CV is stronger, you can apply for surgical specialty too. So duration of the residency in US varies from 3 years to 7 years. Internal medicine, neurology, those are 3 years of residency. But if you want to do neurosurgery, that is 7 years of residency. So this varies from 3 years to 7 years. And for super specialty, you have to do fellowship after your residency. So PLAB process is not that complex. There is interview and exam process. You have to give interview in certain hospitals, and they will take I think entrance exam, I'm not sure about it, but they take entrance exam plus interview for in order to match, in order to get the residency. In UK, it's not that hard to get surgical specialty. Lots of people get surgical specialty in UK compared to US. So surgical specialty is not that hard for PLAB. So if you are interested in any surgical specialty like surgery, orthopedics, plastic surgery and all of that, you might have to choose PLAB over USMLE. If you want to go in surgical field, you can do PLAB. Duration of residency in UK varies from 5 to 9 years. There is only one specialty that you can do for 3 years, that is general practitioner. General practitioner duration is only for 3 years, but if you want to go in radiology, internal medicine, surgical field, whatever it is varies from 5 to 9 years. So it is kind of longer than USMLE. So that can be a plus point for USMLE, that it is shorter and you can get over with your residency so much sooner than UK. In super specialty, it is included in this 5 to 9 years. So you don't have to do fellowship separately in order to be super specialist. So super specialty is included in this 5 to 9 years. There are MRCP and MRCS exam. I'm not sure about those exams, but I know that you have to do MRCP or MRCS for certain fields. And I guess that is super specialty exam. If I'm wrong, please mention me in the comment that I'm wrong about this. You can correct me in the comment. So now we are going to talk about the cost of USMLE and PLAB. So estimated cost for USMLE is around $20,000. Yeah, you heard right. It is $20,000. If you want to pursue USMLE, your pocket needs to be filled with $20,000. So if you are not so sure about spending this much money on just one exam in order to apply in residency, then you can choose another option, which is UK. PLAB estimated average cost is $10,000. It is lot cheaper. It is like half of the USMLE cost. If you are not really sure that you want to do USMLE or PLAB, you can see these numbers and decide. And this matters most. But the return of this $20,000 is really nice. So now we are going to talk about the salary in residency and specialist doctor. In US, average resident earn is from $55,000 to $65,000 per year. And a specialist doctor, after you complete with your residency, they earn between $250,000 to $300,000 a year. So this is really nice return of $20,000. PLAB in residency, average resident earns about £30,000 to £50,000. So it is kind of same as USMLE. But in specialist doctor, they earn only about £85,000 to £110,000. That is not so much big hike from £30,000 to £50,000, but this is really less salary for doctor in UK. And they are right now protesting too for salary, I guess. So you can decide from these two numbers, from cost and salary, in which pathway you want to go. I know this number doesn't matter for a certain person, but for some person it is really important whether they want to go in US or whether they want to go in UK. One more thing I want to add is that in UK, doctors earn about this much after they become super specialist, and in US, after you become super specialist, it can go up to $500,000 per year. So think about it, your $20,000 investment will have really nice return in some years. I'm not saying that you should only choose USMLE. I know lots of people doesn't like it. Lots of people wants to go in PLAB because PLAB exam are relatively easier than USMLE. So lots of people are choosing that. So I'm myself going towards the USMLE and I'm planning to apply in March 2025. So if this video was helpful to you, then please hit the like button, because it will give me immense motivation to make this kind of videos, and subscribe to this channel so you are not gonna miss any video that I make in the future. I wish all the best for your future, whether you go with USMLE or whether you go with PLAB. Bye bye.